Time now for this week's Health Matters. I've got Lynn on the line, Lynn Szabo, PA, our vaccination maven. How you doing this week, Lynn?
I'm doing good, although I'm a little vexed today because I was in Klamath immunizing, and out of the 30 people we had scheduled, 10 didn't show up,
Oh, no.
even with reminder calls and stuff like that. And I don't know if it's known very by very many people in Crescent City, but there is kind of an explosion of COVID in Klamath right now. So casino closed, hotel closed, Paymay probably closing. They might even close off the res again like they did almost exactly a year ago.
So, I mean, I don't want you to speak out of turn, but do you have any sort of insight as to like numbers and prevalence? Because what we have, we've got the dashboard from Dr. Raywalt and the county site, and that's just numbers, no actual any more definition or details to any of those.
Yeah, I think there is a cluster of families who are related to each other that are all kind of have been exposed, and they're trying really, really hard to to do what they need to do to get that reined in, but it involves a lot of school age kids.
Mm-hmm.
And so we're just starting to immunize teachers at Margaret Keating Elementary. So I've talked to nervous teachers. I think one of the reasons we had a lot of no-shows, which, by the way, were equally divided in between people who were getting the shot for the first time and people who were getting their second dose.
Huh.
I think people were afraid to go out.
Oh,
Because
wow.
there were some people afraid to go into the Abalone Grill, which is where we're immunizing. And so I think some people just were afraid to go out.
Wow. So
And
just COVID fears keeping people away from the vaccination.
right. Yeah,
Wow.
some people speculate because the weather was nice and stuff, but these are elders, and this is really on their mind, and I think they're truly kind of terrified. So we're double masking as the CDC recommends, and we're trying to get everybody at United Indian Health who wants to be vaccinated as much as possible, because I think what's going to happen in the next week or so is they're going to start opening it up to selected people who are outside of United Indian Health.
Okay.
So that would be kind of exciting and probably worth calling them if you think that you might that might work for you.
Oh, well,
So I
yeah,
know,
I'm ready. I
yeah,
got my arm. I'm walking around with my arm bare. I'm ready
yeah,
for a vaccination. Wow.
right.
And it's
Exactly.
and
So, if you listen to Biden's speech, he had a national televised speech. Probably you were out running around and missed it, but he sounds like the whole tier thing is going to be a thing of the past by May 1st, which is actually about 6 weeks away.
wow, wow, okay.
Yeah, and he says there'll be vaccine for everybody who wants it by May 1st, and he is his goals that he set at 100 days. He's accomplishing them at 60.
Wow. Oh,
Now I
wow.
didn't check the data. Okay, so I didn't fact check him because he only finished speaking about half an hour ago.
Hmm.
So, and some of it sounded a little off to me, but that on the whole it sounds really positive.
Yeah, yeah. And
So
all of those his speech and what you've outlined is happening down in Klamath. I mean, we are not out of the woods, despite the two states that are opening up 100%
oh
now,
yeah,
and we're just, hey, it's all done, and we're not there yet, but it's getting closer. Uh,
yeah, there really is light at the end of the tunnel, and it's not an oncoming train, as they say. So
yeah.
it, but there's reasons to be prudent, but there's also great reasons to celebrate. So one of them is, what does this vaccination get you? So like, what's the point of it? What does fully vaccinated mean, and how does that change your life?
Hmm.
So fully vaccinated means 2 weeks after the second dose of a two-dose series. So that's the messenger RNA, Pfizer or Moderna, or 2 weeks after a single dose vaccine like Johnson and Johnson.
That
Okay.
means that those 2 weeks have given the vaccination time to trigger what it needs to trigger in your immune system, and it should be
Right.
at full force by then, right?
Right.
Okay.
That's going to be like the top of the bounce that you get as far as your antibodies. So although you do actually get a pretty huge result with the first one. But you remember there's different levels of the immune system. There's the innate immune system and the acquired immune system. And, sometimes when one starts to fade a little bit, you still have the backup of the second. So.
Okay.
So anyway, fully vaccinated means 2 weeks pretty much after your last dose of vaccine. So what do you get to do? What do you get for that?
This is exciting. I heard this announcement from the CDC. This is cool. I'm sorry, I interrupted. Go ahead.
Yeah, CDC says after you've been fully vaccinated, you can gather indoors with other fully vaccinated people without wearing a mask.
Wow.
And some people might call that normal life and what they've been doing all along, but now you can do it safely.
Oh my gosh.
Instead of, not safely. And you can gather indoors with unvaccinated people from one other household. So say I was a grandma and I'm vaccinated, but my daughter is not vaccinated, and but I wanted to go visit her. So I can go visit her, and we can be in the same household without masks unless somebody is sick or unless somebody has a really increased risk of severe illness.
Why the one household limitation? Is that just to limit downstream possible contact tracing?
I think that's an easy way to limit number of people.
Sure. Okay.
Yeah, because once a household, my household is one. So yours is what, 1, 2, 3, 4?
Well, it's just Lisa and me and a dog and 2 cats in our household. But yeah, we do have an extended household here in the whole KFUG compound too.
Right. So, so I guess you would define your household as you and Lisa, so 2 adults. So if you've been exposed, let's say you got the vaccine, you're greater than the 2 weeks out from your last shot, and you've been exposed to COVID-19, you do not need to quarantine or get tested unless you have symptoms.
Wow.
Or live in a closed community like, Pelican Bay or, a detention center or a group home. So that's huge. That is huge. And if you're a contact of a contact, that's not really a contact. So what that means is, let's say I'm in a room with a patient that I find out 2 days later has COVID, but I hung out when I got home, let's say my daughter was visiting and I hung out with her, she doesn't have to worry about getting tested because I'm immunized and she's a contact of a contact. So that's the risk goes way, way down.
So how does that work then with because I've read too that the people who've been vaccinated can still pass on COVID-19. Is it just at a much lower viral load?
No, I don't think that's really true.
Really?
No. So remember when we started talking about the messenger RNA vaccines, and I was saying, that I kind of wanted the Pfizer one, and you were going for the Moderna one. You were surprised that nobody had done routine testing in those 2 studies to see if anybody had asymptomatic COVID, and we were like, what? So what they were looking at specifically in that study was to see if the vaccines prevented people from getting severely ill or dying. They weren't looking at to see if transmission was prevented. And so what happened is they're not willing to say transmission's being prevented. They're looking at that right now. They can't guarantee transmission isn't being prevented, but it kind of looks like that's what's happening.
Okay.
They're not ready to say it yet because they don't have the data over time.
Gotcha. Okay.
Yeah. So I haven't seen anybody say that there's been documented transmission of the virus from somebody that was fully vaccinated. So
No, in fact, and while you're talking, I'm doing something very underhanded, and I'm going and I'm Googling to see where I read that and where I found. And what I found was an article from Bloomberg that says exactly what you've just said. The short answer is we don't quite know yet the clinical trials, just basically explaining exactly what you explained. So
right.
I might have been guilty of just headline reading or something like that when I saw that. So my bad.
Yeah, it's confusing. It's really confusing. But I wish they had done the studies like that. But then what would have happened? The studies would have been dragged out, and
Hmm.
We wouldn't have gotten the vaccines as quickly. So,
And just
hypothetically,
today, I'm sorry to, but just today, this blew me away. But a Biden somebody on the task force working for President Biden actually praised Operation Warp Speed from the Trump administration because they did in fact get the vaccines developed, or at least facilitated, or kick the right people in the right rear ends to get the vaccine, get the companies to work on the vaccine.
yeah, I do think they deserve credit for that. They didn't, as we know, I think it's the Pfizer vaccine was not influenced by Operation Warp Speed, but the Moderna one was.
Hmm.
So, yeah, and the other ones, there's like 164 vaccines that are being produced right now. And there's a bunch of vaccines in the rest of the world. The 164 are just the ones that are like in the United States. There's ones from China, there's ones from Russia, there's ones from Europe. So, definitely it's a race to the top to see what the best one is.
Hmm.
I think I have my money on the messenger RNA, which just happened to be technically easy to do quickly.
Right.
And I was listening to an interview with a guy who's a pediatric vaccinologist, so he studies vaccines in children, because I'm researching the next topic is when do we immunize the kids, and why might we and why might we not? But let's see, what he said is that they're using this messenger RNA stuff to look at, it's probably going to be a paradigm shift, and it's probably going to be the way vaccines are made now.
Yeah, exactly.
And this is really exciting, a vaccine for HIV.
Really?
Yeah, a vaccine for hepatitis C.
Wow! So this is breaking through to the next level of
Right.
coming up with vaccines. Things that for decades we haven't been able to address. This gives us a new tool. Wow! Oh, that's exciting.
Wow! Yeah, this is a true paradigm. So amazing.
Mm-hmm.
I mean, I didn't see that coming. I don't know why, but I was standing there with my mouth open.
Yeah.
So,
Yeah. Wow.
mind blown. So what's still the same about after you're vaccinated? You still have to wear masks in public. You should still social distance. You should still avoid crowds. And if you're with unvaccinated people from more than one household, or visiting somebody with increased risk factors, you should still wear masks.
Okay. And again, this is for other people.
Right.
Yeah.
Yeah. You should also delay travel. So if you can't, then follow the CDC guidelines, which are actually kind of onerous anyway. The CDC guidelines are that you get tested 1 to 3 days before you leave on your trip, that you wear a mask, social distance, wash your hands. You might consider carrying a portable HEPA filter, which they have, that runs on batteries. Let's say if I was in a taxi or something, or an Uber.
Okay.
Yeah, and that would clean the air about in a 5-foot circle around me.
Oh, wow.
Yeah, avoid touching your face, avoid contact with people who are sick. This is all, we're going to recite this in our sleep.
Yeah.
So, but don't travel if you know you've been exposed, or you know you have a positive test, or you feel sick. And then they want people to get tested again 3 to 5 days after their trip and self-quarantine for 7 to 10 days after travel.
Okay.
I know of 0 people, including medical people, that do this.
You've just been on a trip, and then you come back and you're going to take a week off. It's cumbersome. That's true.
Yeah.
Do you have any sort of insight? Define a trip. How far is a trip?
I think a trip would involve, I think it's more like the method of travel. So if you're sitting in your car by yourself, and let's say you drive to Medford, that's not really a trip.
Mm-hmm.
Especially what you might get out and get gas in Oregon because it's cheaper.
Mm-hmm.
But as long as you're careful and wearing masks, and you should double mask now, and you go up, you don't stay overnight, you're not hanging out indoors in restaurants or anything, and you come back. I don't really think that's what they're talking about. I think what they're talking about is, like, I decide to fly out of Arcata, fly down to the Bay Area, take an Uber to a place, hang out at a meeting, spend the night at a hotel, and then fly back the next day. That's definitely a trip.
Yeah.
So you should be tested 3 to 5 days, or 1 to 3 days before, and tested 3 to 5 days after, and they're asking you to self-quarantine for 10 days, no matter how you feel or what the test results are. I think that's I know of nobody who's been able to do that.
Yeah.
I don't even think Fauci could do that because he'd be on one big long quarantine.
Yeah, exactly. It's life as quarantine. Exactly. Wow.
So, yeah, it's, I think certainly people who are immunized feel safer traveling. I think the airflow issue, the ventilation issue is kind of an important one, and it's been overlooked. So there's definitely room to talk about that. But you know what's going to happen is we're all going to, it looks to me like immunizations are going to speed up, and on all of these, things are going to be kind of irrelevant. The point's going to be moot. That's the most optimistic, I think.
Wow, and to have that expanded availability for everybody else after May 1st is that's wonderful. That's really, really cool. Like my folks are vaccinated. My mom and my stepdad, and they're planning trips. They're people they haven't seen, family they haven't seen all across the country. They're trying to map out where they want to go and do these things. So, and I just go ahead.
One thing that I've noticed in immunizing people, so I'm immunizing a lot of elders, right? The grandmothers will stop at nothing. They know they're not supposed to travel, but somehow they think going down to the Bay Area to see a grandkid for an extended weekend is not really traveling. And it's like the grandmother denial is enormous.
Yeah, what are you going to do? Are you going to disabuse them of that? Or are you going to, how do you deal with it?
I decided I was only responsible for myself, and I don't have grandchildren, so maybe I don't understand it. But, oh my God, there's no way I would do that. But everybody's different, and maybe there's ways that they feel they can mitigate the risk. I don't know. So
I think they're just all superheroes is what it is. And more power to you, Grandma, but still at the same time, you could get somebody else.
They definitely want the immunization. They're definitely clamoring for it.
Yeah.
So the grandpas will do what the grandmas tell them to.
Yeah.
They're kind of bowing out.
So grandmas are the key here is what you're saying. The linchpin dollars.
Oh my God. They're COVID warrior queens. I'm only a COVID warrior princess.
Right on.
But the other thing I learned too, this is a quick aside. I saw a Facebook post where you were really frustrated. Oddly enough, they do have some studies, and people who are stressed about getting COVID tend to get it more often because the stress itself makes their immune system not work as well. So
which Facebook post are you talking about?
So I think you wrote something about being really frustrated about being in this situation and being really angry at people who either didn't take it seriously or embraced ignorance or, definitely by their behavior, drug this out for a long, long time.
See, but I'm not afraid for myself because I have that typical.
Oh, you made that clear. Yeah.
Okay, cool. So I have that typical, I'm an American exceptionalist. I'm above the law for me personally, but it's just a society wide and all of the people who've already died that didn't need to die because we handled this so poorly.
Right. And we certainly did. But they, kind of in that context, though, I was listening to one of the medcrams and it was interesting about anxiety and how it affects your immune system. And they actually have data now that shows that, weirdly enough, that the people who worry most about COVID, it doesn't matter with, you could say, well, then why should anybody wear a mask? But that's not what I'm saying. It's the people who worry. Has nothing to do with mask behavior. Masks are good. But that worry itself tends to lower the immune system function, and weirdly they get it more often.
Wow, yeah. Become a self-fulfilling prophecy that way. And people, I think just as a society, we're only getting just now, it seems, around to understanding how mental states affect your actual physical health too. So
it was kind of an interesting talk, and his suggestion at countering that, because it's a little hard not to be anxious about a really dangerous situation. That there's some evidence to suggest that 20 minutes of moderate exercise 3 times a week actually will mitigate that and put everything back into balance.
Oh, okay. Well, I got that covered.
We're back again to the forest bathing thing.
Exactly. That's all with grandmas and forest bathing. Those are the keys.
There you go. Yeah. Pivotal lessons.
That's it, exactly.
But I would really like to encourage everybody to get immunized. It looks like availability, especially in the pharmacies and also at United Indian Health, is going to increase. Call for information. I don't have specifics yet, but I know on the other radio stations that they've been interviewing people, and so there's information about this particular situation out in the media, specifically with United Indian Health. And so we're talking. We have apparently we're doing well enough to be trusted with some some bigger vaccination events.
Mm-hmm.
Usually we vaccinate like 20 to 30. Now we're getting to 60 to 100.
Well, and United Indian Health was the first agency to start vaccinating here in Del Norte, right?
Yeah, I think the vaccine rollout at United Indian Health was exceptionally well done.
Yeah.
And I'm not the administrator whose blood, sweat, and tears are going into this. I'm just, I'm there mostly if somebody has a reaction, then I can, use my medical talents for it. But mostly I'm just putting needles in arms and trying to get the vaccine into people. But the administrators there have worked really, really hard. And I think that they'll continue to help the community outside of the native population, and it's coming soon.
Wonderful.
Like in a week. So really exciting.
That is very, very exciting. That's fantastic. And so thanks again. Another good one this week. Is there anything else?
I'm thinking about talking about kids next week. Because they're starting actually studies right now to do immunizations on kids, and what they mean by that is ages 5 to 16, I think.
Wow.
I think some are 16, some are 18, but they're going to start immunizing young people over 16. And actually at Teen Clinic at Open Door, we immunized our peer counselors. And I think she's actually one of maybe less than 3 people in her age group that have been immunized. She was stoked, man. Really excited. So
go show it off.
Yeah, so it's exciting. It's going to be available for them too.
Yeah.
So,
and I guess if there was anything that could have been so much worse that wasn't, that's one thing, is that kids just kind of escape by and large the whole coronavirus thing. They just just sit on the sidelines.
The way they did is the mechanism by which they were spared is kind of starting to be understood. So that's exciting. So stay tuned, sports fans.
Right on. All right. Well, thanks for that tease.
Okay.
Lynn Szabo, PA. We'll talk next week on next week's Health Matters. Thank you so much.
Sure thing. Bye-bye.
Bye.